Hey everyone, thanks for joining. Today we're talking about the mysterious case of the disappearing thyroid mass. Functional medicine case study for you. I'm Dr. Craig Mortensen. Today I want to share a fascinating case that recently came through my office. Now, before we get started, I do want to remind you that this is not medical advice. Every patient is different. I'm not telling anyone to ignore their doctor or skip recommended testing. This case does raise some very interesting questions about inflammation, the body's ability to heal on its own, and why we should always be looking for root causes. So let me tell you a little story of what happened here. So a patient of mine, a woman in her late 50s, early 60s, first came to me several years ago. Years earlier, she had been diagnosed with a thyroid cancer and underwent a thyroidectomy, meaning her thyroid was completely removed. So she was on medications. As you can imagine, going through this cancer diagnosis changed her outlook health dramatically. She became extremely proactive about her health, focused on nutrition, lifestyle, and preventative medicine. And eventually she sought me out to help optimize her overall wellness. Over the years, she did very well. Her labs improved, her energy improved, her gut improved, inflammation. Overall, things were heading in the right direction. She was feeling great. Then during a routine visit with her oncologist, something unexpected happened. A lump was noticed in her neck. Because of her previous history of thyroid cancer, this obviously raised some concerns for her doctor and for herself. She was referred back to her primary care physician and underwent an ultrasound. Now, that initial ultrasound identified a mass that was 2.5 centimeters by 1.8 by 0.8 centimeters. So not a small mass. Even more concerning, the report noted vascularity with the lesion. Now, why does that matter? One of the things radiologists look for when evaluating suspicious masses is blood flow. Abnormal blood vessel growth can sometimes be associated with tumors because rapidly growing tissues often require increased blood supply. So given her history and the ultrasound findings, her physician recommended moving quickly with a biopsy. Hurry, hurry, hurry. And honestly, that is understandable. If a suspicious mass is found, getting tissue confirmation is often considered the gold standard. But the patient was very concerned. She had already gone through cancer treatment years earlier and was hesitant about immediately proceeding with invasive testing, with good reason. So she came to my office asking a simple question: what else can I do? Now, to be clear, we did not tell her to ignore her doctors. What we did focus on aggressively was creating the healthiest internal environment possible where she continued monitoring the situation. So we readjusted her lifestyle, readjusted her supplements, diet, inflammation, different therapies, focusing on cancer. We optimized vitamin and mineral status and did some kind of more aggressive alternative cancer treatments. We used targeted supplements designed to support her immune system, healthy inflammatory responses, antioxidant levels, and cellular defenses. In other words, we attacked all the terrain. That's a concept functional medicine practitioners talk about often. Instead of focusing solely on the disease, we ask, well, what kind of environment are we creating inside the body that created the disease in the first place? Is the body inflamed, elevated sugar? Is oxidative stress high? Are nutrient deficiencies present? Is the immune system functioning optimally? Because those factors influence virtually every aspect of health. Then we waited. Yeah, we just waited. Approximately 2 months later, she underwent a repeat ultrasound. And what happened next, well, kind of surprised us. The previously identified mass was no longer visible. It was gone. Not only was the mass gone, but the vascularity that had been previously associated was also absent and gone. Does this prove it was cancer? No. Does it prove it was not cancer? No. Without a biopsy, nobody can say with certainty what the lesion represented. Could it have been inflammatory tissue? Yeah. Could it have been a reactive process? Sure. Could it have been scar tissue? Yeah. It could have been something entirely different that we don't know. That is a possibility. That's why medicine and functional medicine really requires humility. But here's what we do know. A significant abnormal finding was documented. The patient implemented different changes. And then 2 months later, on her repeat imaging, it was gone. The abnormality was no longer present. That's not an opinion. That's simply what happened. The lesson here isn't that supplements magically cure cancer. The lesson is that inflammation matters. The terrain matters. The body internal environment matters. And sometimes when we improve those factors, remarkable and even miraculous things can happen. One of the biggest mistakes I see in healthcare is focusing exclusively on finding disease when ignoring what may be driving the dysfunction in the first place. So whether we're talking about heart disease, autoimmune conditions, diabetes, neurodegeneration, or cancer risks, chronic inflammation is often one of the common threads connecting all of those things. That's why I spend so much time talking about nutrition, sleep, stress, exercise, environmental toxins and exposures, gut health, targeted supplementation. These aren't alternative concepts. They're foundational concepts. And cases like this remind us that the body is often far more dynamic, adaptable, and complicated than we give it credit for. So I'd love to hear your thoughts. Have you experienced a situation where the health issue improved after making major or minor lifestyle changes? And if you enjoy hearing real-world functional medicine cases like this, be sure to like, subscribe, and share this video. Thank you for watching. I'm Dr. Craig Mortensen. I'll see you next time.